everybody just coming in. We'll get started in just a little bit, just so people have a chance to get their audio dialed in before we start talking. All right. And I'll make sure I type this out for people that come in later, or if you don't happen to catch all of it. But welcome to today's mental health webinar. Before I hand it off to our presenters, I just want to cover a few technical details about this platform. Today, it's very important, or more important than usual, that you are comfortable with the interactive capabilities of the platform. So we want you to use whatever you want to use effectively, but the three main ways you can do interactions are through the chat, the Q&A function, or by raising your hand to speak. Your cameras and microphones are disabled by default, so if you do want to speak, you can go ahead and use the raise hand feature, and at appropriate times, I'll announce you and unmute you, and you can ask your question or share your experience out loud. But if you'd rather type, you can use the chat. If you do use chat, make sure that you type select all panelists and attendees from the drop down there. Or you can use the Q&A function if you have a specific question for Abby, and we can get to that as well. So without further ado, I want to hand it off to Melanie Gottlieb.
Thanks so much, Mike. Good afternoon. I'm Melanie Gottlieb, Deputy Director at ACRO, and I'd like to welcome you to the third webinar in our mental health series. As always, we're hopeful that our technology will not fail us. This is a large Zoom call, and we at ACRO, like most of you, are working remotely and so remain at the mercies of our home Wi-Fi's. I'm confident that if we have any technical challenges, we will solve them. We planned this series in response to the many conversations that we've had since this spring with our members who are managing the personal and professional fallout related to the pandemic. You've been asked to reinvent your jobs again and again, support your staff and your students, and meet institutional goals with less resources, and we know that it's taking a toll. Our surveys indicate an unprecedented level of stress for our members, and so we wanted to give something back that might help support you as you navigate this ongoing crisis and support your students, your institutions, and your families. Don't worry if you missed the first two. The recordings are available in the archived section of the ACRO website, and we hope that you will visit them. In the first, Dr. Perry Graves gave us some great tips for managing staff with compassion. In the second, Nicole Weyer shared some useful information to combat burnout. Today, we'll talk about mindfulness with Abby Wills, lead instructor for ACEI Mindfulness Training Program and co-founder and program director of Shanti Generation. Abby has dedicated over 20 years to integrating mindful practices for social emotional health into a wide diversity of school settings through direct service to learners and educators throughout the US and internationally. She brings her expertise in developmental education as well as extensive studies in yoga and mindfulness to her work as a teacher and a writer. So now I'd like to turn the mic over to Abby.
Thank you, Melanie. Thank you so much to ACRO for inviting us. It's been a pleasure to join ACEI Global Consulting just since March when this whole thing started, where Jasmine Sadie Keenert invited me in to come and meet some of the needs that we're all experiencing right now in this new world that we're living in. And, since March, we've been meeting every other month or so doing these mindful minutes with ACEI. And our approach for this time, this short time that we're together, is to create a pause in our lives. And what we're hoping to pause is this mental work of trying to figure out what's happening now, trying to figure out what's going to happen next, and to move out of the thinking, planning mind for a short period of time in order to nourish our personal and collective well-being. So that's really the goal of our time together today, is to really press pause and give our bodies, our minds, our hearts a chance to connect and a chance to remember what really matters for our own health and well-being, which ultimately contributes to us being able to figure out what's happening in the world. I'm going to pause for a moment just to share my screen. And welcome to everyone. Thank you for taking the time on a Monday morning to be here and to do something to care for yourself. It's much appreciated, because we all benefit when any of us pause to take care of ourselves. So I wanted to give you just a quick overview of how we will likely spend our time, although depending on what your input and questions might be, things may go differently. So welcome, and please enjoy settling in for a mindful pause. We'll take just a little brief look at the science behind mindfulness and awareness, and how mindful awareness works in our lives, in our bodies, in our neurobiological systems. And then we'll practice. So we titled this webinar "Coming Back to Our Senses," which is sort of a phrase that we use maybe when we've been thrown off track. Come back to your senses. I think we've all been thrown off track quite a bit lately, and we will literally use our senses to bring us to the present moment. And then we'll do a standing mindfulness practice, which I think we all are tired. Many of us are tired of sitting. So for some, this may be new to do some standing mindfulness practice, which can be just as effective, even more so for some people. We'll do a little Q&A and then close with some reflections. So before we launch into that, though, I wanted to pause just to see who's here and sort of where our experience with mindfulness lands. That would really be helpful for me to know. So if you could open your chat, make sure, well, actually you can choose if you want to respond to all panelists and attendees or just to panelists here, your choice. If you would just think about your experience with mindfulness, and that could be a variety of different mind-body connecting experiences. Like if you have a yoga practice or you have a meditation practice, maybe you practice Tai Chi or Qigong or some other form of mind-body integrating practices. If you would just let me know, just a yes or no, do you have experience with mindful practices, or is this new to you? So the question is, do you have experience with mind-body practices? I see people using the Calm app. That's a good one. Some folks are saying it's new, and for some, yes, a small amount of experience. Right. Yes, but not very good at it. Thank you for your honesty and vulnerability. Sometimes it's hard to make time for it. Okay, so we have lots of people coming who are new to this. Welcome, and I'm so glad you're here. Some folks saying you have exposure and you're aware of these practices but haven't had the experience. We have someone who meditates every day. Thank you for being here, Doreen, to help hold space. Headspace, yoga. Okay, great. Your audio is going in and out. We're hearing from a participant. It's hard to establish a routine and habit. Okay, thank you all so much. It's really, really helpful to know. So I believe it's important to spend a little bit of time talking about what mindfulness is and what it's not, even before we get started, especially since we have so many people who are new to this. So simply put, mindfulness is the purposeful practice of bringing our awareness into the present moment with whatever is happening. It sounds very simple, and it is, but that doesn't mean that it's easy. It can be very difficult at first. And over time with practice, just like anything, we learn to come to the present moment mindfully, almost as a reflex, as opposed to when we get started where it feels like we're trudging through, so many thoughts and mind patterns and resistance in order to get into the mindful present moment. So it's simple, but not easy. What's interesting about mindful practice is that we are on purpose directing our attention to things. It could be sensory, sounds, feelings, visuals, or people, not necessarily people, but we're directing our attention to things that don't need our attention. Right. And so most of us are very used to our attention and our awareness balances between things that need us. Right. So we're always looking at, what do I need to do now? What's next on my list? What's on my agenda for today? And our awareness bounces between those things. And every once in a while, something may be out of the window, a bird lands on the windowsill and it catches our attention. It doesn't need our attention, but those are the moments that we feel like we have a break and our mind can be free for a moment. So ultimately, these practices are about liberation. They're about creating more freedom in our minds to direct our attention to where we want it to be. So the paradox is, though, that we're going to be spending time today listening to sounds around us. Those sounds don't need us. So I like to think of it as we need them in order to come into the present moment. And so a lot of the resistance that comes up around meditating, building a routine, finding the time, comes down to there's other things that we think we need to be doing for many of us. How can I sit here for 15 minutes when I have a sink full of dishes and a child on Zoom and colleagues who are waiting for this document? How can I validate spending this time working with my mind when there's so much to do? So the answer to that is that when we don't take the time to pause and come into the present moment is when we start to reel out. And that's when our stress levels go through the roof. That's when anxiety and depression start to kick in because we never stop. And literally our nervous systems go into overdrive, right? And so we're always pressing that gas pedal. Well, what happens when you always press the gas pedal? You run out of fuel. So these pauses are about putting on the brakes. So temporarily slowing down, consciously, purposely putting on our brakes so that we can move our nervous system literally from that space of fight or flight, freeze and submit, that constant, radar of what needs to be done, what's wrong, figuring out, into that break mode, that pause mode, where we enter more of a rest and digest space, where we can remember that even inside of all the chaos and confusion that all of us are experiencing now to some degree, that there is still good in the world and that we are still alive and we have our breath and we have some capacity to make space for ourselves and our families and our colleagues, our teams, to be to appreciate what is still good. And so that becomes a counter to all of the stress and anxiety, right? What mindfulness is not, it's not pushing away our thoughts. It's not completely clearing our mind. It's not perfectly peaceful. In fact, in the beginning, when we sit for mindfulness, people have all different sorts of experiences. Sometimes it's a really peaceful and quiet and calm and inviting experience. Oftentimes it isn't. Oftentimes when we sit and we purposely bring our attention into the present moment, we find that our minds are extremely cluttered and there is a constant overlapping of thoughts and it can be disconcerting. So that's why we have these very important aspects of mindfulness that help us come to the present moment in a particular way. So it's really, really important to remember that we're not coming into the present moment in order to evaluate ourselves. It's hard for some of us, right? To judge ourselves, our environment, or the people around us, but that we're coming to the present moment with a motivation towards well-being for ourselves and others, with curiosity, all right? So an open mind to look and see what's happening. And this is really important, with some degree of kindness for ourselves. So if we come to this practice and we're judging and evaluating and assessing how we are and who we are, the practice can be counteractive. It can be a time where we ruminate in what's wrong and we worry. And so when we purposely sit or stand or enter this mindful practice with an intention and a motivation to come to ourselves and to come to our minds with a sense of kindness and curiosity, sort of like how you might approach a toddler that you don't know. Like if you're walking down the street or you're sitting in a cafe, when that happens again, and a beautiful child walks by, and you look at them and you're curious and kind to them and you want to have an interaction. If we can approach our own minds with just a little bit of that motivation, we'll have a much more positive and successful experience with mindfulness. So I just want to pause for a moment after saying all of that and invite any burning questions anyone may have about what mindfulness is or what mindfulness is not. You can use the chat or you can raise your digital hand and Mike will unmute you if you'd like to speak. This moment is important just to sort of clarify for ourselves what is the scope of mindfulness? What is it not? Any questions at all before we move forward into our practicing? So you can chat, use the Q&A, or raise your hand. I'll just pause for a few more moments in case anyone's typing or configuring your question. The shortest definition of mindfulness. It's a really good question. So the one I typically use is sort of a riff on Jon Kabat-Zinn. If anyone's familiar with Jon Kabat-Zinn, he's sort of known as the father of mindfulness in the West. He used mindfulness to treat, he's a doctor, to treat people with chronic pain. And his definition is sort of like mindfulness is bringing our awareness to the present moment with kindness and curiosity. Yes, being self-aware, for sure. That is a component of mindfulness, is to be self-aware and ultimately to be aware of others as well. So it starts with that self-awareness. And for many of us, that's a big journey. What is the self? So we use the body. We create physical body awareness. We become aware of our emotions, aware of them, right? Not pushing them or pulling at them, just aware and watching them come and go. We become aware of our mental fluctuations. And ultimately, this practice is meant to create more awareness among all of us. So self-awareness, social awareness, self-regulation, it's a very social, emotional blend. Any other questions before we move into a short practice? Okay. I'm going to go back to this pause symbol. So the first practice I would like to do is a really simple one. Again, simple, but not necessarily easy. And it's about using sound to bring us into the present moment. So I like to change my position a little bit when I'm starting a mindful practice. So if I'm, sitting kind of relaxed and casual in a chair, I might sit up tall and place my feet on the floor. You can stand for this if you'd like. You can stay seated. You can be seated on the floor or in a chair. You can even walk around for this practice. It's really what's going to serve your body the most. But I do suggest making at least a subtle change in how you've been sitting, how your posture has been for this first 20 minutes of the webinar, so that you're signaling to your brain that something's changing. We're moving into a different experience, which can just kind of wake up the brain a little bit. So if your feet are on the floor, whether seated, standing, or walking, I'll just invite you first to find your ground, to bring your awareness on purpose to the ground, to feel your feet on the floor. And take a few moments to allow your awareness to settle down towards the floor. If it helps you to close your eyes, to bring your awareness more internally, that's fine. For some of us, keeping the eyes sort of half open is also helpful. And to just allow our gaze to steady in one direction so that we can start to really feel the feet on the floor. Don't worry if that is difficult. That it's very common in the beginning to meet some resistance when we want to allow our awareness to sort of settle into a place that doesn't need our awareness right now. So noticing that resistance, if it's there, and also noticing if there's ease. Can you allow your awareness to just easily fall into the body, down to your feet? Notice any sensations in your feet, any sense of pain, any sense of tingling, or just the presence of your feet. If you're standing, feel the weight of your body in your feet. And if you're sitting, also feel the weight of your seat in the chair or whatever furniture you're in. And as you feel your feet and your seat, perhaps, notice any subtle shifts in your body as you bring your awareness from thinking to feeling. And if it feels good to you, deepening the breath and taking a couple of deep inhales and longer, slower exhales, do so. If that does not feel inviting to you, it's fine to just allow your breath to flow organically without changing it at all. Good. And for the next few moments, start to tune in to the sounds around you. So we're listening in a very effortless way. We're not trying to find a sound. We're just listening for any sounds that may be there. And when you notice a sound, the practice, the instruction is really simply to notice it. And you might label it. That's the sound of the fan. It's not necessary to label it. But the practice is to hear without having to go into any sort of story about it, without having to judge whether that's a pleasant or unpleasant sound. If your mind does that, fine, you can notice that too. But the instruction is not to make any sort of declaration about the sound, but just to hear the sound, to notice the qualities of the sound. And in a moment, I will be quiet for about 2.5 minutes. And the instruction is simply to notice sounds. So as you notice, and you probably will, that your mind starts going into thoughts and planning and thinking or evaluating the sound, notice that, come back to listening. That's it. Noticing what the mind is doing, coming back to listening. And so we'll start our 2.5 minutes now. And you can notice at this point in your practice if the mind is sort of consumed in thoughts like, why am I doing this? Is this a waste of my time? There's so much else I need to be doing. Or you can notice if this feels nice to have a break from having to plan and figure out that I can be in this present moment and experience sound. And that can be just what it is without having to make it good, make it bad, or anything else. So at this point, let's come back to just noticing the sounds around us. Okay, and now just slowly start to bring your awareness back to the webinar, the visuals, the space around you. You can feel your feet on the floor. And I like to take a moment after a mindful practice, even as short as that one. Some of you may not have thought that was short. If you want to slow down time, meditate. But I like to take a moment, and I advise everyone to take a moment when you're coming out of any practice to just kind of look around your space, look around the room that you're in, or if you're so lucky to be outside, look at the sky, and just kind of reorient yourself to the space that you're in, noticing what's around you, maybe even looking back over your shoulders, looking back, and just reorienting yourself to the room or the space that you're in. And that functions in several different ways. For one, it gives us a chance after a practice to just sort of notice how we shift, how our mind shifts after a short practice. Maybe we notice something there we didn't notice before. But also just this looking around and looking over our shoulder, this simple movement sends a clear signal to our brain that we're in a safe place, right? We're not going to casually look around and look over our shoulder if we're in danger, okay? We're going to be in a totally different state of mind. What I'd like to share is that it's not inherent in all types of mindful practice, but in the mind-body practices that I practice and teach, simple movements can have a significant effect on our mental health. So something as simple as if you're sitting in the chair and you just sort of sway side to side, or if you tap your heels in rhythm, or tap your toes, Just these simple movements, looking back over our shoulder, doing a little subtle twist of the spine. Or my favorite, if you imagine that the tip of your nose is you're going to use as your like there's a crayon, let's say. Sorry, I teach children a lot, so I hope you'll appreciate this. Imagine the tip of your nose is a crayon, and you're going to draw a figure 8 or an infinity symbol in the air. So you're just going to move your head, your nose as the leader, and draw this figure 8. Some people call this the Stevie Wonder. I love Stevie Wonder, and just thinking about him makes me feel a little bit better and lighter. So if you just do this simple movement, and so what's happening right in the neck and the cranium is there's a sense of flow. We're not going to be doing this kind of a movement if we're in danger. And we're not, there's always some degree of danger in the world, but we can trust that at this moment, we're relatively safe. And so to give our brains this signal on purpose that we're safe can help to alleviate the chronic, tight, rigid, fight or flight kind of stress that we can find ourselves in, right? Those sound so simple, and it may not feel profound the first time you try a simple movement, but if you can get in the habit of sitting down at your desk, sitting down to work, or just before a meeting or a Zoom call, whatever it is, just giving your body even just a reach up and down, a simple movement for the purpose of saying, I'm safe, I'm alive, I'm okay, I am not in significant danger right now, then we can start to pull our awareness down into the body a little bit more and more. And we start to hear the messages that our bodies are sending us. So it's a multi-directional system, right? We can send messages to the brain. The brain is constantly sending messages back. And we can do that on purpose to let ourselves know that we're safe. So can you remember any of the sounds that you heard? If you would just type a few of them into the chat. Did you hear a sound that surprised you? Any sound that surprised you? A sound that surprised you, or a sound that you found amusing? Sometimes when we pause, we hear sounds that have been going on around us for months and we haven't noticed them. The refrigerator buzzing, the paper shredder, daughter sneezing about 6 times in a row, fireplace fan. That was my ringtone you weren't expecting. I was trying to set the alarm for 2.5 minutes. I think it was mine that you heard. Just the blower in my office. It's always happening, but I don't notice it. The phone ringing, the dog snoring, dishwasher, puppies. Aw, we have lots of furry friends with us. The heater in my daughter's game, husband typing. So, so many sounds around us. That's it. That's the practice, really. It's noticing. In this case, we're noticing sounds, right? As we progress in the practice, we'll use less and less of these supports, they're called. So the sounds were a support for our mind. We gave our mind something to do so that it wasn't just in autopilot, reeling from one plan to the next, right? In a moment, we're going to try a totally different practice, which is using our vision. So using a different sense to bring us into the present moment. So those are all supports. For some of you who have been practicing mindfulness and meditation for some time, you may have entered a different phase of the practice, which is mindful practice or mindful meditation without support. And that's when we're simply choosing to sit or stand or walk for a period of time and allowing our mind to stay present with whatever is happening. So it could be a sound, it could be something in our visual field, it could be a sensation in our body, it could be thoughts. So that's more of an open monitoring, using our awareness to just notice whatever is happening. I find that in the beginning stages, it's helpful to have a specific support, which could be sounds, could be what we'll do next, which is a visual image, could be the breath. It could be one anchor or place in the body. There are lots of choices, and you'll find the one that works best for you. Practicing for 5 minutes a day, up to 10 or 15 minutes a day, just using one particular support will help to train the mind, right? To stay in the present moment. And then once we have that experience and we experience some of the benefits, then we can move into a more open monitoring or allow our mind to be present with whatever is happening. I do want to say at this moment that I'm really confident that anyone, whether this is challenging for you at this moment or easy, all of us have the capacity to practice some form of mindfulness, that the awareness is already there. We don't have to create something new. Our awareness is already here with us at all times. Whether it's in the present right now is what we're working with. Oftentimes our awareness, right, our attention and our focus is on the past, or it's on the future, right? Or it's with us now worrying about something that's happening right now, okay? So that's just how the mind works. We already have that awareness. And so the good news is we can learn to bring that awareness into the present moment, to purposely say, I'm moving out of worry right now, and I'm moving into what's actually happening right now. Now, sometimes we may practice that particular process when there is something to worry about. If we're sitting at the bedside of someone at the hospital, right? And there is a very clear and present situation that has us feeling sad or worried or angry or mad or afraid, then mindfulness becomes about being with all of those emotions, right? So in this short period of time that we have together today, we're kind of keeping it light because we have a very short period of time. But as you practice and grow with this practice, you can apply the exact same process to difficult emotions and also to pain, physical pain. So let's move into another practice. This time I'm going to invite you to stand if you can and if you like. It's up to you. And I'm going to bring up this piece of art. Can someone give me a thumbs up or a yes if you can see this, an image of a painting, an abstract painting? Yes, thank you.
Yep.
So you can orient your screen if you need to be able to stand, if that's available to you, or you can stay seated. It's completely up to you. I'm going to stand. And perhaps move yourself a little bit away from your screen. And take a moment to place your body in a stable position. So having the feet slightly apart may help, a wider base, and having the feet parallel can be helpful. And taking a moment just to first sense your physical body in the space that you're in. So feeling your feet on the ground, feeling the center of your body, rebalancing over your feet. Maybe even feeling the crown of your head slightly reaching upward so you can feel your whole body stable and strong. And please modify this for your own body, for whatever situation you find yourself in right now. Okay, if standing is not an option, you can absolutely do this sitting or lying down. And now for a few moments, let's use our sense of sight on purpose to look. So for a few moments, just allow your eyes to wander around this painting. This is a painting by Howardina Pendell, who's a Philadelphia-born artist and art instructor. And allow your eyes to just sort of wander around the painting for a few moments and see what you see. See what you notice. In particular colors, shapes. And if you find and notice that your mind is getting hooked up in any kind of thoughts, see if you can bring your awareness back to simply noticing what you're seeing. And now allow your gaze to settle on one part of this painting. It could be a point or a quadrant, some particular place on this painting. And as your eyes begin to settle into one direction, let your eyelids soften a little and allow your gaze to become just a little softer. So we're not staring, we're allowing the eyes to soften. And as your eyes soften and remain steady in one direction, bring a little bit of awareness now to your breathing. And follow your breath in and out as your eyes stay steady. Good. And now continuing to breathe in a way that feels good to you. Let your eyes again wander and try to find or look for a blue place in this painting, a blue part of the painting. And then look for an orange part of the painting. And then look for a yellow part of the painting. And a red part of the painting. Good. And then let all of that looking now just dissolve. And either close your eyes if that feels good to you, or find something else in your space that you can let your eyes settle on. Something that might be pleasant to you, a color you like, and let your eyes either settle in one space somewhere else. It could be the painting, it could be something else, or close your eyes. And now let's shift from looking outward to looking inward. So we're going to shift our awareness now to noticing any sensations in your body. Allow your awareness to simply scan through your body from your feet to the crown of your head. And notice sensations. It could be a gurgling in your belly. It could be pain, density, a tickle, a twitch. It could be a feeling of opening or ease. And without really getting caught up in any sort of a story about what we're feeling, we're just feeling the senses, the sensations of the body. And when we notice thinking is happening, we come back to feeling, to noticing sensations in the body. Good, and if you'd like to, you can try shifting your weight from one side to the other. So shifting the weight of your body over to your right foot for a moment, and then over to your left foot slowly. Sometimes that little bit of movement is enough for the mind to settle a little bit more into the body. Good. And now, as a final shift, you can keep shifting left and right if you'd like, or stay steady, up to you. But now we'll shift our awareness from noticing the sensations in the body to simply noticing the rhythm of your breath. Following the length of the inhale, following the length of your exhale. Noticing the quality of your breath. Does it feel cool or warm? Does your breath feel full or shallow? And does your breath feel fast or slow? Somewhere in between. Good. It may help to put one hand over your chest and try to feel with your hand your heartbeat. It requires us to get very still and very quiet to really tune into the heartbeat. And if you can find it, you can connect the rhythm of your breath with your heartbeat. So breathing in for as many heartbeats as works for you. And breathing out for maybe a few more beats than that. And you really can't do this wrong. There's no wrong. If you feel like you're doing it wrong, come back to the breath, your heartbeat. Come back to the sense of your own body. And see if you can find a little spark, just a little glimmer of appreciation for yourself in this moment. Appreciation for yourself for taking this time to care for yourself, to do something that is simple but not easy, to take some time to get to know your mind and connect the mind and body, but also to appreciate all that you're doing in your field, in your work, in your career, all that you're doing to assist and support other people. If you find it difficult to find that appreciation for yourself, look a little deeper, just like we were looking at the painting. We were looking for a color. We were looking for a shape. Look purposely on with intention into your own field and see if you can find a little bit of appreciation for yourself. And just as you're breathing, as you're noticing how that feels, can you name it? Can you name something? I won't ask you to share it, but can you name something that you appreciate about yourself? And now think of someone that you love. This is the first person that comes to your mind. And can you think of something you appreciate about them? Think of something you appreciate about one person that you love. And can you really name it in a word or a phrase? And now, can you notice your body right now? How does your body feel as you are practicing appreciation? Notice any subtle change in your body as you purposely think of appreciation, as you conjure and generate appreciation. Do you notice any shift at all in your body? Good. And now we will slowly begin to bring our awareness back to the space around us. So if your eyes are closed, you can slowly flicker them open, take a look around. They're half closed, let them open wide again. If you're standing and you want to come back to seated, please do. And so just taking a moment to come back from the practice. So how was that for you? In the chat, or if you want to raise your hand, would anybody care to share? Did you notice anything different? Or did you differently notice anything about your body after the appreciation practice? So I'm seeing a participant said lighter, that they felt lighter when thinking of appreciation or when appreciating. Relaxing, felt like I was going to sleep, slowed breathing, calmer, relaxing. Yeah. Lowered the heart rate, sleepy too, very common. Yes, that's one of the challenges of practice, is that it's easy to get sleepy, and that's fine. It's just part of the process. Relaxed. Okay. And does anybody, I would invite everyone who feels compelled and comfortable, if you thought of someone that you love and something that you appreciate about them, I would invite you to type that into the chat to everyone. And as their responses coming up, then all of us can just see these appreciations and good, strong support, and just allow ourselves to remember that we're on this call with lots of other real people who love lots of other real people, and just allow these thoughts, these appreciations to be sort of a connection between us as you're taking in people's responses, just finding that your own sense of appreciation for that as well. Thank you. Yeah. So we just have a couple of minutes before I hand the platform back over to Acro and Melanie and Mike. Are there any closing thoughts or questions from our participants? Yes, you will get a recording. I believe the recording is going to be available. Actually, I should let Melanie answer that one towards the end, but I believe it will be. Yes, thank you as well. Yes, the recording will be available. A specific part of the day to practice mindfulness, really, really good question. It really depends on your day and when you feel that you have the most time and space for it. Many people find first thing in the morning, like maybe after you press go on coffee, to take 5 minutes. Others find right before sleeping, especially if you have trouble sleeping, falling asleep, that can be a wonderful time to practice. I personally like to practice in the middle of the day because that's when my own children are done with their school and it's sort of before the bulk of my work starts. That's sort of my gap. I would say it's helpful in the beginning to find a consistent time. It's not totally necessary, but many people find that supportive. But I would really just work with your own life and find what works for you and let that be your time. There's no real, one way or the other. Yes, and someone is saying that they added practice in the morning, but added 10 minutes over lunch. That's helpful. Sometimes we need a little more support right now. Yes, and we also, so we have all of our ACEI mindful minutes recorded as well. So they're available on the ACEI website, which I will pull up that slide for you in case you want to make a record. There's the website. It's on the aceiglobal.org. Okay, and so with that, I will turn over the platform back to Melanie and Acro. Thank you so much for inviting us to join you today, Melanie. It's been a pleasure to be with your community, and I wish you all ease as much as possible for the rest of the day, and lots and lots of good fortune and ease for the rest of the week as well.
Thank you so much, Abby. I don't know about everyone else, but it sounds like we're all feeling much better prepared to face our week. And so thank you very much for that. Just in answer, in case people didn't see it in the chat, this has been recorded and will be available in the ACRO archived webinars, and we hope that you will revisit it whenever you feel the need or have the opportunity to sort of retry the practice, because I think with mindfulness, practice makes perfect, right? Or as close to perfect as we get, because there's no expectation of perfection. Mike, if you could share the slides, the next slides, that would be great. So I will say we really missed seeing our members at the ACRO annual meeting this past spring. And while all of our in-person events have been suspended in the near term, we know that you and your staff continue to have significant professional development needs. And so the months ahead are packed with virtual content that the ACRO staff and all of our hardworking leaders and volunteers have been putting together for all of you. And so we hope that you will join us in some of that content. We also have one more mental health webinar coming up, and that is the first week of November. And so check the ACRO website for that. We have launched a new communication called This Month at ACRO, and that's to share with you all that we have planned. If you missed that email, because we know your inboxes are just as full as ours, you can always check the calendar on our website and it will be up to date. We hope that next week you'll join us for ACRO's first fully virtual conference, which is the SEM conference. We have frozen early bird pricing, and the agenda is really packed with not only sessions and plenary panels, but in-depth workshops that are embedded within the conference and included in that fee. And I think that for those of you who have been at SEM before, you're going to find that it's a new, different kind of experience. And if you've never had that opportunity, I hope that you will take this opportunity to join us, because I think you'll find it really, really rewarding. Thank you again for joining us today. We hope that we will see you online again soon. Take care, happy Monday, and have a good rest of your week.